Welcome back to the deep dive. Today we're taking a look at some tricky musculoskeletal issues, specifically infections and inflammation.
That's right. We're talking about problems in your bones, joints, and muscles. Things like osteomyelitis, septic arthritis, myositis.
Exactly. The plan is to explore what these are, why they're important to understand, but, without getting totally lost in the medical jargon.
Precisely. We're focusing on those three key areas you mentioned: bone infections, joint infections, and muscle infections or inflammation. And knowing a bit about these is, well, pretty vital
Vital how?
because they can cause serious trouble if they're not caught and treated early. We've sifted through our sources to pull out the really essential bits for you.
Okay, great. So let's quickly picture the system itself. We've got bones giving us structure, right? And making blood cells, storing minerals,
Yep. Then muscles, obviously, for movement, contracting, relaxing.
and the joints connecting them, allowing that movement. They've got cartilage acting as a cushion, synovial fluid for lubrication.
And ligaments holding things together is quite an intricate setup.
What really stands out, though, is how they get their supplies, isn't it?
Ah, yeah. That's a key point. Bone is highly vascular, lots of blood vessels running through it. Good for healing, generally.
But cartilage is the opposite.
Pretty much. It's a vascular, meaning no direct blood supply.
Hmm.
Makes it harder to fight off infection or repair itself if damaged. The synovial membrane, that lining in the joint, that's what makes the lubricating fluid.
Got it. So what actually causes these infections and inflammatory problems,
Well, for infections, it's usually microbes. Bacteria are the most common, especially one called Staphylococcus aureus. You might know it as staph,
including MRSA, the resistant kind?
including MRSA. Yeah, it's a tough one. But viruses, fungi, even parasites can sometimes be culprits too, though less often.
And inflammation, is that always infection related?
Not always. Sometimes it's the body's own immune system going awry. Autoimmune disorders like rheumatoid arthritis or lupus can cause significant musculoskeletal inflammation. The body attacks itself, essentially.
Okay. And how do these infections actually get into the bone or joint?
A couple of main ways. Direct invasion is one, like from a deep wound, a fracture that breaks the skin, or even during surgery.
Makes sense.
The other route is through the bloodstream. An infection somewhere else in the body, maybe minor, can sometimes travel through the blood and settle in a bone or joint.
Wow. Okay. And inflammation, what's the mechanism there?
That often involves chemical signals, cytokines. They're part of the normal immune response, like alarm bells, but sometimes they get overproduced or stick around too long, causing damage to the tissues.
Right. So let's get specific. Osteomyelitis, the bone infection, what does that look like?
Typically, you'd see localized bone pain. It might feel deep, persistent. The area could also be warm, red, swollen. Sometimes systemic symptoms like fever and chills pop up too.
And it can be sudden or long term.
Yeah, there's acute osteomyelitis, which comes on faster, and chronic, which can grumble along for a long time, sometimes flaring up.
Okay. Then septic arthritis, the joint infection. He said this one is fast.
Very fast. Rapid onsets, pretty severe joint pain. The joint often swells up quickly, becomes red, warm, and it's very painful to move. Fever is common here too,
And the speed is critical because
joint cartilage can be destroyed really quickly by the infection and the resulting inflammation. Delaying treatment can lead to permanent joint damage.
Oof. Okay. And the third one, myositis, muscle infection or inflammation.
Right. This one involves muscle swelling, tenderness, maybe weakness. If it's infectious myositis, you might also have signs of a wider infection like fever. It's maybe less common than the other two, but still very serious when it occurs.
So how do doctors figure out which of these, if any, is going on?
It starts with a good clinical assessment. Looking at the affected area, feeling for warmth or swelling, checking the range of motion, how well you can move, listening carefully to your symptoms.
And then tests, I assume.
Oh.
Blood work.
Definitely. Basic blood tests can show signs of infection or inflammation, like a high white blood cell count, or elevated ESR and CRP. Those are inflammatory markers.
Do they tell you what bug it is?
Not directly, but blood cultures can. If bacteria spread to the blood, growing them in the lab can identify the specific type and help guide antibiotic choice.
What about seeing inside? Imaging.
Crucial. X-rays might be done first, but they often don't show bone infection changes until it's been going on for a week or two.
So what's better for early detection?
MRI. Magnetic resonance imaging. It's much more sensitive for picking up early inflammation and infection in bone, joints, and soft tissues like muscle.
And for osteomyelitis, sometimes they need a sample.
Yes, a bone biopsy is often considered the gold standard for confirming osteomyelitis and identifying the exact pathogen. It involves taking a small piece of the affected bone.
Okay, let's talk treatment. What's typically involved?
It's usually a multi-pronged approach. For infections, antibiotics are key, and often for quite a while.
How long are we talking?
Weeks, sometimes months. It often starts with intravenous IV antibiotics in the hospital, followed by oral antibiotics, pills, once things are improving.
And for the inflammation side?
Anti-inflammatory drugs can help. Things like NSAIDs, non-steroidal anti-inflammatories, or sometimes corticosteroids, especially if it's an autoimmune cause.
Are there non-drug treatments too?
Absolutely. Surgery plays a big role, especially in osteomyelitis and septic arthritis. It's often needed to drain pus and remove any dead or infected tissue that's called debridement.
Makes sense. Get the source out.
Exactly. Immobilization, like using a splint or cast for a period, can help rest the affected area and promote healing. And then physical therapy is usually vital afterwards to regain strength and movement.
You mentioned earlier that acting fast is important. What are the risks if treatment is delayed or doesn't work well?
Well, the complications can be pretty severe, unfortunately. Osteomyelitis can become chronic, a really persistent problem that's hard to get rid of.
And septic arthritis?
It can lead to permanent joint destruction, arthritis, chronic pain, and significant disability. It can really impact your mobility long term.
Any risk of it spreading?
Yes, a major concern with any serious infection is sepsis, where the infection spreads throughout the body via the bloodstream. That's a life-threatening medical emergency.
Wow. Anything else?
In very severe, uncontrolled infections, particularly in bone, amputation might become necessary as a last resort. And with severe myositis, you can get muscle necrosis, basically muscle tissue dying off.
So it really underscores the need for prompt attention.
Absolutely.
Yeah.
So wrapping things up, the main point is that infections and inflammation can hit different parts of the musculoskeletal system: bones, joints, muscles. They have various causes: bacterial, sometimes autoimmune.
And getting the diagnosis right quickly using exams, labs, imaging
is crucial for starting the right treatment, whether it's antibiotics, surgery, anti-inflammatories, or rehab. It really minimizes the chance of those serious long-term complications we talked about.
Definitely valuable to understand this stuff and recognize potential signs. Okay, here's a final thought for everyone listening. Considering how interconnected everything in our body is, especially the musculoskeletal system, how might our everyday choices, diet, exercise, maybe even stress levels, potentially influence how susceptible we are to these kinds of infections or inflammatory issues? Something to ponder.
Good question to leave folks with.
Thanks for joining us for this deep dive.